I'm grateful for the opportunity to speak to you, our public health and healthcare heroes, who have been on the front lines navigating the largest global public health crisis we have faced in a century. You, as members of IMI, stepped forward to serve as a medical authority on pandemic protocols for the Muslim community, including sharing national guidelines for opening community centers and schools, and helped interpret those guidelines so that information on keeping our children, seniors, and families safe was available to everyone. You managed healthcare clinics across the country, including your partnership with Clarkston Community Health Center here in Metro Atlanta. Clarkston is perhaps the most diverse community in the United States, as it contains the country's highest refugee population per capita. Your clinic there provides free health care to thousands of individuals and was able to continue to operate throughout the pandemic, providing support, testing, and vaccinations. IMI provided communities with financial, nutritional, and medical aid, including securing and distributing hundreds of thousands of dollars of PPE across the United States to struggling medical clinics and community centers during the early part of the pandemic. And IMI provided COVID-19 related aid to 12 countries, sourcing oxygen concentrators, sending medication, running oxygenation facilities, and providing rations and nutritional aid. Who knows how many lives have been saved and will be saved through your efforts, and for this we owe you a debt of gratitude. Thank you, the members of IMI, for showing up for this fight every day and for learning and adapting along with us. I know this is not where we hoped we'd be in October of 2021 as we descend from Delta's peak. Our hospitalizations and death rates remain far too high. Our best path forward to prevent more cases, hospitalizations, and deaths is to practice the very prevention strategies we know work and to vaccinate as many people as we can, as quickly as possible. And as a corollary to care, not just for ourselves, but as you do every day, to care for one another. Your advocacy for vaccination is making a difference. Thank you for the vaccination clinics and campaigns you have run across the country and specifically here in Georgia. IMI and the faith community have worked hand in hand to share the importance of getting vaccinated and worked to reduce vaccine hesitancy. As health professionals coming from vibrant communities of faith, you have been able to bridge divides and support faith leaders as they have worked as advocates in the care of their communities. You have invited them to attend your virtual programming and helped them actively promote the messaging of masking and physical distancing during religious observation. The pandemic started in this country among the affluent, first arriving via people with the resources to travel on airplanes and cruise ships. It quickly spread to people with the fewest resources. That's where the disease settled, and the people in those communities have suffered the most. Many data points around the pandemic probably leap to mind when you consider the inequities. One very striking figure is the staggering disparity in years of life expectancy lost in 2020, at least partially due to COVID-19. 1.2 years of life lost for white Americans, but an astonishing 2.9 years for Black Americans and 3 years for Hispanic Americans. The pandemic has illuminated inequities that have existed for generations and revealed for all of America a known but often unaddressed epidemic impacting public health: racism. The challenges driven by structural factors, racism, discrimination, and historical disenfranchisement produce barriers which can dictate where a person lives, where they work, where their children play, and where they gather as a community. And they can have lifelong negative consequences on mental and physical health. As a physician, I saw firsthand the perils of inequity. I treated patients who had to make impossible choices between filling a prescription or ensuring their plates had food. In April, 10 weeks after becoming CDC Director, I declared racism a serious public health threat that directly affects the well-being of millions of Americans and, as a result, affects the health of our entire nation. It was important to me to bring my passion and advocacy for health equity to my role as director of the agency charged with protecting the health of all Americans. Of course, CDC has long recognized that racism is the root cause of many health disparities. That April declaration made it clear that we were recommitting ourselves to the work of addressing the structural factors that deeply impact the communities we live in. A growing body of research shows that centuries of racism in this country have had a profound and negative impact on communities of color. The impact is pervasive and deeply embedded in our society, affecting where one lives, learns, works, worships, and plays, and creates inequities in access to a range of social and economic benefits, such as housing, education, wealth, and employment. These conditions, often referred to as social determinants of health, are key drivers of health inequities within communities of color, placing those within these populations at greater risk of poorer health outcomes. The data are clear. When compared with their white counterparts, racial and ethnic minority groups across the United States experience much higher rates of morbidity and mortality across a wide range of health conditions. COVID, yes, but also HIV, chronic diseases, maternal mortality, firearm violence, and mental health. Declaring racism a serious public health threat forces us to reckon with long-standing racial and ethnic health disparities that are severe, far-reaching, and unacceptable. Racism also deprives our nation and the scientific and medical community with the full breadth of talent, expertise, and perspectives needed to best address racial and ethnic health disparities. To build a healthier America for all, CDC is committed to making health equity a priority and addressing racism as a root cause of racial and ethnic disparities. As an agency, we recognize the systemic nature of the health inequities that exist in our nation's health infrastructure, and we are working to address the many roadblocks that prevent communities of color from receiving access to care. Just to touch on one of those roadblocks, we must make sure our public health workforce reflects the diversity of the communities we serve. IMI's internship program, providing training for international medical graduates, has supported much needed diversity in our healthcare workforce by helping more than 800 interns enter residency programs in the United States as they begin their careers. Clearing the path for emerging public health scholars and practitioners from the communities we most need to reach will ultimately help us achieve a more equitable system of care, one that ensures that all can achieve their healthiest life. We still have much work to do. We need to move flexible resources to our grassroots organizations, those closest to the community. For example, CDC will award $300 million over a 3-year period for COVID-19 prevention and control efforts by community healthcare workers. I think particularly of a community health worker from my time working at Massachusetts General Hospital and caring for those with HIV. He was so connected to the community and his patients that they had developed a huge level of trust in him. If they were lost to medical follow-up, he would unfailingly find them. And I recall one such patient who had stopped coming in for care. He tracked her down and learned that she had stopped coming in because her HIV had thinned her hair and she was nearly bald and she was embarrassed. And this community healthcare worker found her a wig and with that solution escorted her proudly into the clinic. And only because he was close enough, trusted enough to have that conversation, were we able to ensure that she got the care she needed. The trauma of the past months will have a long-lasting impact not just on our communities, but on all of us as physicians, scientists, and public health providers. Please, while taking care of others, do not neglect yourselves. For us to get through this pandemic, we need you to be healthy as well. Reach out to us if we can be helpful. You are talking to the people we have not met and may not be able to reach. What are the resources you need when you talk to your communities? We want to make sure you have those resources. And how can we support you in your work? When asked when this will be over, I have to say the future is up to us. We have the science and we have the tools to end this pandemic. We just all must set our sights on battling our common foe, the disease and the virus.